me, start here means that you really have to just jump in. No waiting, just kind of jump in, do something, say something, start something.
Don't lose any time. Don't wait for somebody else to get started. Figure out something you can do and do it now.
Well, I think first off, we need to meet people where they are. We can't come in with a concept of perfection, as I think is so common in our society, that people think, well, if I can't run a 10K, I just will sit here on the couch. But instead, well, maybe you can walk a block. The concept of risk reduction and, as I said, meeting people where they are, see what you can do, what small steps you can take.
So when I think about that theme, I usually start with the community as a whole. As a community, we have to be concerned about each other's health. And from there, I look at my friends. As friends, you have to look out for each other and talk about our health and talk about what issues are affecting our health. And then look at my own personal family. And then I look at myself. In order for me to be concerned about my community, my friends, and my family, I have to make sure that I'm healthy as well.
I think that means that everyone truly does start from their own place, and that place is different for everybody. So as a leader, I need to recognize that kind of variation in where people are and where people are starting from, and help support them in learning and in taking the actions that they can take from wherever they are, so that we all can move forward together.
As a public health leader, I'm also a part-time college professor at the University of Maryland, Baltimore County, and which I teach a public health course to undergraduate students. And I always try to impress upon them that public health is important, the public health field is wide open, lots of disciplines are involved with public health. No matter what your major is, you can really get involved in public health and accelerate your career from that point on. So I would always say to my students, public health is great, and you can start here with your career by learning about public health and going forward from there.
Well, what it means to me is that I should also take personal responsibility for working with people inside of public health in multiple areas. As someone who is also a department chair, work with my faculty and staff students, reach out to the communities in our areas, particularly because I live in a rural area, and begin to educate, get people involved, get people to do public health related types of educational activities, intervention type activities, those sort of things. I mean, basically what we're doing now. So that's when immunity starts me, but also take more of a facilitated role.
Well, what I'd like to do is I'd like to get our country to figure out that they really do want to see the nation to be healthy, and that they want to pay for it, and that they want to integrate public health and medical care.
That's a very good question. And when I think about that, there's a lot of issues and a lot of things we can look at to make sure that we're a healthy nation. But my particular interest is paternal involvement in improving pregnancy outcomes. I truly believe that as we decrease infant mortality rates, and they have shown decline, but as we decrease them even lower, we have to make sure we get our fathers involved in carrying out the process of not only conceiving the child, but make sure the child is born healthy and make sure the child grows up into a healthy adult.
I think the first step is to partner with our communities, find an encouraging way to get people involved, find out what's important to them, and what will help them want to be the healthiest nation in one generation.
Well, continue to do the work that we have doing now. I mean, with particularly in maternal and child health, there's a number of issues that are now coming to the forefront in our area. And so what we plan to do, and this is natural for us who are at MCH, is that we always take a life course perspective, always take a life course point of view.
As you know, tobacco use is the single most preventable cause of premature death in this country and perhaps the world. So, and I've been working in tobacco use prevention for about 20 years now, and I'm always trying to get the word out that tobacco use is dangerous, especially in the advent of new tobacco products being introduced to the market. So as a public health leader, I would try to improve upon that message to get people to stop smoking. If they don't smoke, don't start, to try to make sure that we can have a healthy generation in the future.
I'm going to keep on doing what I've been doing, which is trying to do research that help promote and figure out what works best for our public health system. I'm going to continue trying to educate the current and future public health nursing workforce. And I'm going to try to be healthy myself, because I'm a part of this generation and a part of this nation. And so I want to be a role model and be contributing myself to the health of our nation.